This healthy living tip is brought to you by the Christ Hospital Health Network.
Arrhythmia is a term for an issue with the heart's electrical system. The heart has a very coordinated cadence whereby the rhythm starts in the top chamber of the heart and then emanates down to the bottom of the chamber of the heart in a very coordinated fashion. When you have an arrhythmia, when a patient has an arrhythmia, the problem is that there's an erratic nature to that. It might beat too fast, might beat too slow, it might beat in an uncoordinated fashion whereby one side of the heart maybe beats sooner than the other side of the heart, and that can alter the way the heart squeezes. That can then lead to a variety of symptoms. Sometimes people feel tired, sometimes people feel dizzy, or they might faint. They might have a sensation of erratic pulsing or skipping in their heart. They might, as they exercise, have trouble meeting their capacity. They can't walk up a flight of stairs without stopping, catching their breath, those sort of things. Well, there's so many different manifestations of arrhythmia, there's a broad range of treatments that go along with them. So for some people, it's simply reassurance, letting them know that that little skip they feel is not harmful and perhaps best ignored. For other people, we might tell them, well, that skip you feel actually requires attention, even though you're not bothered by it. It could lead to problems, so you may need to do something for it. Now, the things that we do for people could be medications, it could be procedures, such as surgical procedures like pacemaker implantations or defibrillators for the most serious arrhythmias. We also have arrhythmias that we can cure so that they go away forever with a procedure called ablation. Ablation is a procedure that allows us as electrophysiologists to find the source of the arrhythmia and to eliminate it entirely, generally by applying some form of energy that either heats up or cools down the area of the heart where the arrhythmia arises. And that can eliminate the source of that arrhythmia, and then the problem goes away. Yeah, arrhythmias occur in people of all ages and all levels of health. Healthy people that have no health problems whatsoever, young, can have arrhythmias as their only manifestation of a heart problem. Many of those people don't have anything serious, and some people have something that requires further treatment. We also see arrhythmias on the other end of the spectrum in our sickest patients, those that have congestive heart failure or maybe have had a heart attack before in the past. And we pride ourselves within our group on not just being the technician that implants the device, and not the technician that actually does the procedure, but provide the comprehensive care. We generally will meet people ahead of the time. We always tell people I'd like to meet you wearing regular clothes, not scrubs. Not with a mask over my face. We sit down with them ahead of time and really get to know them, find out if this is right for them. Then we'll be there and do the procedure. And then afterwards, we continue to take care of them. They're my patients. If I put a device in them, they're my patients for life. And I'll continue to see them on a regular basis. Christ Hospital has been a big supporter of cardiac electrophysiology. When I came here in 1997, we had one laboratory, and we now have four. We now have four dedicated electrophysiologists that do everything heart rhythm electrical. They don't do balloons or stents. We don't do any kind of plumbing issues. We're strictly electricians. And with that staff, we also have a dedicated team of nurses and technicians that do simply heart electrical issues as well. In those laboratories, we have access to all the greatest, newest technologies, different types of ablation, different types of devices, and really state-of-the-art equipment, and really happy with what we have there. For those that are wondering, do I have a heart rhythm problem? Should I go see an electrophysiologist? Arm yourself with some information and ask questions. And if it becomes apparent that you have something that we can help with, ask your doctor to set something up. And if not, just give us a call and we'll make an appointment with you.
To make an appointment with a heart rhythm specialist, call 513-206-1180.